Hello. This presentation will be providing a deeper dive into the MBQIP measure, Hybrid Hospital-Wide Readmission. My name is Nicole Freeman, and I will be presenting with my colleague, Ann Logus. Our objectives are to help you have a better understanding about the measure requirements to report the Hybrid Hospital-Wide Readmission measure and identify the steps for success to submitting this measure through the HQR system. Now I'll pass it over to Ann to discuss an engagement activity.
During this presentation, we highly recommend that you participate in a mini engagement activity. As you listen to the presentation, please watch for 5 slides with activity stops marked with a red stop sign. Nicole will also notify and remind you of the activity as she is presenting. These 5 activity stops describe a key step in the collection and reporting of this measure. Because successful submission requires several team members with different skill sets, such as clinical, IT, EHR, and quality skill sets, it is extremely helpful for teams to clearly identify who is responsible for the different steps of the reporting process. It is important to note that there are more than 5 steps, but for purposes of this activity, we have prioritized 5 of the most significant steps. So when these slides are presented, please write down who would be responsible for that step at your facility. Who could be a person, vendor, department, someone inside or outside your facility. It could be you, or maybe you don't know. We will discuss your results at the end of the presentation. Nicole?
Thank you, Ann. Here you will see Ann and I, as well as the rest of our Arquita team. We are so excited to be serving you in your quality reporting efforts. This slide provides a quick visual of the 2025 MBQIP core measure set. As you can see, the Hybrid Hospital-Wide Readmissions is a core measure under the Care Coordination domain and submitted annually through the HQR system. As a reminder, for calendar year 2025, the deadline to submit is October 1st, 2026 at 11:59 p.m. Pacific Time. Data collection will begin with quarter 3 of 2025 for a measurement period of July 1st, 2025 through June 30th, 2026. Now we'll jump into more of the measure details. The Hybrid Hospital-Wide Readmission measure may also be referred to as the Hybrid HWR measure. Hybrid measures differ from the claims-only measures in that they merge electronic health record or EHR data elements with claims data to calculate the risk standardized readmission rate. This measure was adopted for use in MBQIP by the Federal Office of Rural Health Policy, FORP, beginning July 1st, 2025. This measure focuses on unplanned readmissions within 30 days of discharge from an acute hospitalization. The ECQM ID is CMS 529 version 5, which will be important to note when reviewing ECQM resources on the CMS website. As I mentioned, this measure is part of the Care Coordination domain for MBQIP and is also available for reporting in the CMS Inpatient Quality Reporting or IQR program. The most important part of a hybrid measure is to understand the core clinical data elements, or CCDEs. CCDEs refer to the clinical information captured in an EHR for adults who experience a hospital stay. CCDEs are meant to reflect a patient's clinical status when they first present at the hospital for treatment. For purposes of this measure, it is recommended that hospitals only report the first resulted value for each core clinical data element collected. You may choose to report all values during their admission. However, only the first values will be used in the measure calculation by CMS. CMS uses the CCDEs collected by you to calculate the measure score. These CCDEs include clinical variables and linking elements for each patient. Clinical variables include heart rate, systolic blood pressure, respiratory rate, temperature, oxygen saturation, weight, hematocrit, white blood cell count, potassium, sodium, bicarbonate, creatinine, and glucose. And linking elements, CMS certification number, CCN, the National Provider Identifier, NPI, the Medicare Beneficiary Identifier, MBI, inpatient admission date, and discharge date. I think this is a great visual to show how the hybrid HWR measure is calculated. On the left, the CCDEs are pooled into two buckets, vital signs and lab test results, which are captured in your EHR system and exported into QRDA1 files for submission. On the right, it shows the linking variables that will also need to be included in your QRDA1 files. If CMS cannot connect the CCDEs to the claims data via the linking variables, they won't be able to calculate this measure for you. So why is this measure important to report, especially as a critical access hospital? High readmission rates of patients with clinically manageable conditions in primary care settings, such as diabetes and bronchoasthma, may identify quality of care problems. This may help quality leaders with areas of improvement and enhance patient satisfaction. A measure of readmissions encourages hospitals to improve communication and care coordination in order to better engage patients and caregivers in discharge plans and in turn reduce avoidable readmissions and lower costs. It also eases the transition from paper documentation to an EHR by creating an opportunity to integrate clinical information into hospital quality measurement without the burden of manual chart abstraction. But most importantly, it improves accuracy of quality measurement. Claims data does not contain any risk factors associated with severity, which can really impact measure calculations. Historically, claims-based measures do assess for comorbidities. However, the addition of electronic clinical data provides a measure of severity when a patient's admitted that accounts for critically ill patients. Now let's talk about some steps for success that you can take to capture and report this measure. Each year, it's important to review the measure specification as updates may take place that impact the way you are capturing the CCDEs for this measure. As this measure is relatively new for quality reporting programs, it may undergo more tweaks in the first few years of implementation than other MBQIP measures. This measure data is collected for a measurement period of July 1st through June 30th and submitted annually, with data being due on October 1st, 3 months after the end of the encounter period. If the October 1st deadline falls on a federal holiday or weekend, it will default to the first business day thereafter. This measure is reported through the Hospital Quality Reporting HQR Secure Portal under the Hybrid Measure tab via QRDA1 files. This is our first activity question. Who would oversee measure preparation at your facility? After you've prepared, you'll need to dive into the criteria for capturing eligible patients within the target population. For the hybrid HWR measure, the population and denominator will include all patients aged 65 years of age and older with an acute care hospital inpatient encounter, enrolled in Medicare Fee-for-Service Part A for the 12 months prior to the date of admission and during the admission, or enrolled in Medicare Advantage, who is discharged alive from a non-federal short-term acute care hospital and not transferred to another acute care facility with a length of stay less than 365 days. It's important to note that there is no sampling for this measure. Hospitals should report all cases that apply to the population criteria. This screenshot depicts a decision chart that can be used to identify the eligible population within your EHR's workflow and help walk through if a patient will be included in this measure. Activity step number 2. Who at your hospital would be in charge of helping to identify the measure population and implement this into your EHR's workflow in order to capture these patients' clinical core data elements? Please keep in mind that it may be a tag team of people from multiple departments. We want to note that this measure does have patient exclusions. However, no action is required on your end. Exclusions are determined via administrative claims, and hospitals are not responsible for reporting this data. Exclusions include patients admitted to Prospective Payment System, or PPS, patients without at least 30 days post-discharge enrollment in Medicare fee-for-service, patients discharged against medical advice, or AMA, as well as patients admitted for primary psychiatric diagnoses, admitted for rehabilitation, or admitted for medical treatment of cancer. Now that you've identified the initial population, now you can begin to build processes in your EHR to extract and report 13 clinical core data elements with linking variables for each patient claim in your population. Essentially, you will take the list of data elements listed in the specification and provided on the screenshot on the slide and map the value set codes to the places you document these elements in your EHR. Ask yourself, where are you documenting these elements in your EHR system? And start to compile a thorough list. For example, the body temperature data element may be captured in your clinical documentation section of your patient file. Check to see if your system appropriately captures this data element. If so, where and with what codes and code types do you use? This goes back to timing. Think through all the locations where these elements are captured 24 hours prior to and 24 hours after admission as an inpatient. This list is what you will use to map this measure in your system. Once you have your list, go to the Value Set Authority Center or VSAC website. Use the OID, this will be the long number at the end of the data element section of the measure specification, to look up the value set. The results will give you a list of all the codes included in the value set. For example, in the screenshot below, the body temperature is listed as the OID ending in 152. To find the codes available included within this value set, click the hyperlinked OID number. After you review the codes, you'll need to cross-reference these to the clinical documentation of body temperature in your EHR system to determine if your system is appropriately capturing applicable codes for this data element. To ensure CMS can link the CCDEs to the patient claims data, we highly recommend including all 5 linking variables to each CCDE. This is how CMS identifies each patient included within the measure calculation. For calculation purposes, please make sure your CCDEs are recording in the following unit of measurement in your EHR system. To ensure the best measure outcome, you should try to submit all 5 linking variables on 70% or more of discharges with a Medicare fee-for-service claim for the same hospitalization. As I mentioned earlier, the first values captured during the hospitalization will be used for calculation purposes. Also, please try to submit vital signs for 70% or more of the hospital discharges. For vital signs, it should be the first value 24 hours before the admission. If not, within 0 to 2 hours after admission. Hospitals may miss up to 2 vital signs from the number of required CCD data elements and still meet the threshold. Also, submit lab test results for 70% or more of discharges for non-surgical patients. For lab test results, it should be the first captured value 24 hours before the inpatient admission. If not available, the first test results collected 0 to 2 hours after admissions. Hospitals may miss up to 2 laboratory results from the number of required CCD data elements and still meet the threshold. Here is an example of the CCD collection timeline based on the first recorded values. This means the earliest instance of documentation that meets the timing requirement will be evaluated and included in the QRDA file. It's recommended that you capture all 13 CCDEs within these narrow timeframes. Please remember, those CCDEs are telling CMS how sick your patients are and adjusting your readmission rate based on this information. Activity stop number 3. Who would be in charge of working to build processes in your workflows to adequately capture the CCDEs for each patient claim and ensure that each CCDE is recorded in the correct standard unit? Now that you have captured your data, let's talk about what you'll do to submit for your hospital's hard work. We've identified some steps for success for submitting data for the hybrid HWR measure. You'll begin by populating the CCDEs into a QRDA1 files per the most current requirements. It's important to note that many EHR systems have the QRDA1 file export function available within your reports, so please be sure to check with your EHR vendor or health IT department to determine if you have access to this function. If so, how to export these files based on the processes you built during the reporting period. It's important to create and/or check your hospital quality reporting or HQR access before the submission deadline to ensure that you don't hit any issues when comes time to submit. Once the submission period opens, you'll upload your QRDA1 files to the HQR system. Finally, don't forget to verify your submission. Let's go through a few more important steps within these areas. After you've successfully captured the measure data, you can work with your EHR vendor or health IT department to help create and/or export to the QRDA1 files from your system for submission. If you need additional assistance, we've added some great resources to assist with constructing and/or exporting your QRDA1 files from your system. As a warning, if your EHR system does not have the option to export the QRDA1 files and you will need to create the files on your own, this process is very technical in nature. You may need to consult your health IT department or EHR vendor for help creating these files. Activity stop number 4. Who would oversee the extraction of data after the clinical actions have been complete? Will the person creating or exporting the QRDA1 files be the same person responsible for submitting to the HQR system? After you successfully have your QRDA1 files complete, you'll log in to the HQR system. Navigate to your hospital's dashboard menu and click Data Submissions. Under Hybrid Measures, you can select a submission type between Test or Production. Test should only be used to make sure the file type and data is in an acceptable format. Any data that's submitted under Test will not be counted towards your submission. Please be mindful which submission type you select when you're ready to submit. We recommend doing a test for at least one QRDA1 file to determine if it contains any issues before submitting under Production. Final activity stop. Who would be in charge of submitting your QRDA1 files to the HQR website? And do you know if they have the appropriate accesses? After you complete your test, you'll then navigate to Production and upload your QRDA1 files by selecting Select Files. After file selection, you'll see the status as Upload Started and change to Accepted when complete. Once complete, you'll receive a confirmation email to the email address associated with your HQR login. After submitting your file, you may verify the data was successfully submitted to the portal by selecting Data Results on the navigation bar and selecting Hybrid Measures. Under Outcomes, select Production and the quarter that you uploaded QRDA1 files for and select Hybrid HWR. This will show you the number of patient encounters that did or did not meet the initial patient population requirements. If you think you have missing data, make sure you check the encounter window for all CCD encounters included in your file, or if you have all the requirements for the CCD encounters, try changing submission type to test to see if the data was submitted under the incorrect submission type. We wanted to highlight a few ARKITA resources to be aware of. We have updated the 2025 MBQIP Measure Core Set Information Guide that includes details on the core MBQIP measures, the monthly MBQIP reporting deadlines document, and the Hybrid HWR Data Submission Guide, all available on the Telegen ARKITA website. I'll now pass it over to Anne to conclude our engagement activity discussion.
So how did you do with the mini engagement activity? Were you able to determine who is responsible for the 5 steps discussed at the activity stops? We encourage you to use the information you gathered and share this slide deck and the resources included with those individuals. Make sure you have their contact information and that you share that contact information with all involved. Maybe you'd like to have a group meeting. Help them to see the big picture in reporting this measure, along with the steps they are responsible for. Connect with other critical access hospitals to learn their approach to reporting this measure. Use what you have learned about who is responsible for the steps and leave this presentation in action. Set a goal to ensure that all involved clearly understand the step they are responsible for and that they have access and understand the tools and resources available to successfully and accurately report this measure.
This concludes our presentation for today. If you have any questions on the hybrid hospital-wide readmission measure, please reach out to our ARKITA team at the email listed below.